Medicaid's already a program with bad health care outcomes. You look at the Oregon study, they showed by expanding Medicaid there was no improvement in physical outcomes. Oregon to Harvard, now this wasn't a conservative study. The Harvard study showed when you expanded Medicaid after 2 years in Oregon, there was no improvement in physical health care outcomes. Simply giving people a card without giving them access to health care, to doctors, to hospitals, doesn't improve anything. You look at the Oregon study, they showed by expanding Medicaid there was no improvement in physical outcomes. 2 years in Oregon, there was no improvement in physical health care outcomes.
So is there a possibility that this is a surge? Is 18 months long enough to suss out long-term patterns?
It's a good question. Longer-term effects might certainly differ from what you see over an 18-month period, although we didn't see an increase in the beginning that petered out. It looked fairly steady over the 18 months we examined. But certainly longer-run effects might differ, and you also might expect to see something different when insuring many more people at the same time. Our study had about 10,000 newly insured people. That's a lot of people, but it's small relative to the population of Oregon or even relative to the uninsured population in Oregon.
And speaking of the population in Oregon, how representative is it of the rest of the country? Some of the critics of the study have said, well, maybe the poor in Oregon won't model the same way that the poor are in the rest of the country.
Of course, one always wants to be careful in generalizing from any one state to others or from any one study to the nation overall. That said, Oregon's Medicaid program looks similar to programs in other states in many ways. It covers the same types of services, including not just the emergency department, but doctor's office visits, prescription drugs, hospitalizations. It has no copays for enrollees. The population in Oregon looks similar to that of the U.S., with one important exception. There are fewer minority residents of Oregon than there are in many other states. So Oregon might not be very representative of racial or ethnic differences that you would expect to see elsewhere.